One of my colleagues and friends who's a 45-year practicing retired psychiatrist told me of all the substance-induced psychoses, cannabis psychoses is the one that scared her the most because they were the most violent people that had substance-induced psychosis.
Hi again, everybody. Welcome back to The Narrative. Mike Andrews, David Mahan with you this week, and what a week it has been. We've got construction going on all through the building. You're adding like general construction to your job duties, basically, having to deal with all the contractors so we can have some quiet to record the podcast. It's a
live mariachi for you all, but
we told you at the beginning of the year that we are under construction, so you just never know what you're going to find out. But we're going to do things just a little bit differently today because of the subject matter. We took a little bit longer with the interview, but absolutely necessary. Yeah. Talking with Dr. Ken Finn today about the issues with marijuana and legalizing both the recreational use and the medicinal use of it, David.
Yeah, you guys have been hearing us talk about the issue of marijuana for several years, and it was typically about expanding medical because when you do that, the more you do it, the closer we get to recreational. Well, that's where we are, or adult use is another term. And so we just felt like we needed to do a little deeper dive on adult use marijuana, intoxicating hemp. We've got legislation running through the Senate and the House on both. And the members just don't really understand what's going on with this. And which is scary when you look at the rate and how fast these things are blowing through both chambers is frightening, and especially when you hear Dr. Finn break it down today.
Yeah, and the reason that there is legislation moving across the street at the State House, this is probably a good distinction to make too, David, is Issue 2, not a constitutional amendment like Issue 1 was last year. So this can still be regulated by our legislature, correct?
And it has to be. It has to be. Everybody likes to look at other states like Colorado. I mean, here some of the members, as they testify, talk about Colorado and California and Washington. Well, how did it get there, right? Why did it take so long for this situation, to actually start getting some regulations put in? And it's because there was no reporting, right? The potency rates were really high. We didn't have potency caps. Well, unfortunately, what got them to getting some caps and addressing some of this regulatory stuff was that they had to see kids die. They had to see accidents go up and workplace accidents go up. And so we have to, at where we are today in the state of Ohio, we got to be proactive, right? And again, as you're going to hear in this podcast, right now, the loudest room is still the addiction for profit marijuana industry. Watch any hearing that we just had in the Senate, and 90% of what you will see are dope dealers. Literally, you can clearly tell they're dope, and you can definitely smell that they are dope dealers because the whole state house reeks of marijuana. And man, if it wasn't so scary, I'd be laughing.
Yeah. What's the timeline on what's moving through the Senate and the House right now, David? Any idea on when we might see some real action or traction on these?
We've got SB 56 is the bill that has already passed the Senate, and it's a decent bill. I mean, we talk about it in the podcast. There's some safeguards around advertising. They've reduced the number of plants you can have, but a lot of it, when you look at the major issues that this stuff is causing states, it's really not going to move the needle much. We need potency caps, and we need better reporting and research now so that we know what is really happening in our state.
Yeah, and we're going to need our listeners to let their representatives and their senators know how important this is after listening to this podcast.
Right. If we start calling and emailing and scheduling, meetings around this issue, the dope dealers won't be the loudest voice anymore.
And there's one other thing that we do need to mention before we get you to the interview today. Probably need to use some discretion, parents, not to listen to this around your kids, or at least listen to it first before you listen to it with them, because there are some pretty graphic details about what drug use, what marijuana use specifically is doing throughout the country and how it has really negative impacts specifically around psychosis issues and things like that.
Children especially.
Yeah, so it can be a bit graphic at times, but it's very informational. We hope you find it beneficial. Our interview with Dr. Ken Finn's coming up. Hey, Narrative listeners. Christians in the marketplace today face more unique and challenging threats than ever before. Businesses are following woke capitalism, Chambers of commerce are beholden to social justice, and secular activists are chipping away Christians' First Amendment rights. As Ohio's only Christian chamber of commerce, the Christian Business Partnership stands in the gap to advocate for, to educate, and to celebrate Christian business owners. Joining the partnership also allows businesses to provide their employees with healthcare insurance, workers' compensation, and exclusive banking and educational discounts. To find out more and to join, go to cbpohio.org. That's cbpohio.org. Hi again, everybody. Welcome back to The Narrative. Mike Andrews, David Mahan, joined now by Dr. Ken Finn, who's been practicing pain medicine in Colorado Springs since 1994. He is board certified in physical medicine and rehabilitation, pain medicine, and pain management. He's one of the leading voices speaking out against legalizing marijuana, medicational marijuana, and leading the charge in trying to get states to understand what happens when marijuana floods in to places like Ohio after issue 2. So, Dr. Finn, it is great to have you here on The Narrative, and we're looking forward to this conversation.
Thanks for having me. I appreciate the giving of the time.
Absolutely. Well, just go ahead and give us a little more of your background, if you don't mind. How did you get into this fight against marijuana and how we've seen it really take hold in a lot of states where they've legalized not only the medical use of it, but recreational use as well?
Well, that's a really great question. I get that asked a lot. And I've been practicing, as you mentioned, pain medicine for a long time. And in Colorado, we voted to legalize for medical purposes in 2000 and implemented in 2001. And the program lied somewhat dormant for many years because there really was no infrastructure, there were no dispensaries. Doctors were fearful of recommending marijuana because it's not a prescription, which is one way they circumvent the whole, medication thing. And then in 2009, after a lot of politicking at the state level, and actually at the federal level, suddenly the dispensaries opened up across the state of Colorado, where even today we have more medical and recreational pot stores than we have McDonald's and Starbucks combined in the state.
Wow.
So it's literally easier to get weed than it is a latte or a Big Mac. So as that happened, as a pain physician, patients were starting to present to my office with high levels of pain. They were using high doses of opioids, which we know we're in the middle of an opioid crisis, and they were smoking weed for their pain. And I said, wait a minute, what's going on here? That doesn't make any clinical sense to me. Why do you have high levels of pain on high narcotics and weed? Is it helping? Is it not helping? And when I would quiz my patients, and I think that's the only thing I find beneficial, is that there's less stigma that I've noticed with patients, and I have open conversations with them. But when I pin them down, I said, well, is the marijuana really helping you with your pain problem? The vast majority, I'd say well over 95%, said, no, it doesn't help my pain. And so that really made me very curious as to, well, what is going on? So that's when I started reading and educating myself on the cannabinoids, the endocannabinoid system, the relationship between endocannabinoids and opioids. And at the end of the day, the science, even as of today, the science simply does not support the use of cannabis for chronic pain, even cancer pain for that matter. I ended up on the governor's task force for Amendment 64 when we legalized. I spent several years on our state's Medical Marijuana Scientific Advisory Council. And then the next thing I know, I'm an international subject matter expert talking to the United Nations, talking to UCLA, the Mayo Clinic, MD Anderson Cancer Center, who keep asking me to come back because my colleagues simply don't know the public health implications of expanding these marijuana programs. And like I mentioned earlier, the medical programs are simply an entree to legalization. Every single state that has legal programs started with a medical program.
Yeah. And doctor, I mean, I know I'm not telling you anything you don't know. You've been working with us very closely here in Ohio on this subject for several years. But what we're seeing is that there's just a dearth of knowledge of anything that has to do about cannabis or cannabinoids or THC or potency. And unfortunately, when I'm talking to members across the street about the subject, there's only one answer that they give me as to why we're running all this legislation through, whether it be medical or now regulations around the recreational or adult use. And that's, well, we got to get this done. We got to get this done quickly. We're rushing this through. Who typically is behind, who's the brain trust in these states when it comes to marijuana? Because in the state of Ohio, when I'm testifying or watching testimonies around the issue, it's always what I call the white collar dope dealers in the room. They're always the loudest voice on both sides, right? They'll be fighting each other about how much regulation or who gets to, how many dispensaries or who gets to run the show. Is that what you're seeing in other states?
Oh, absolutely. The industry is behind it all. It's all about the money. It's really not about public health and safety. It's not about people with cancer. It's not about children that have seizures. In my opinion, that they paraded them all over the news when we legalized for medical purposes and
That's
tugged at
right.
the heartstrings of the general public. And, oh, look at grandma dying of cancer. And yes, everybody feels for that particular person, but we don't hear about them anymore. They've been used by the industry. They were pawns, in my opinion. They don't talk about seizing children or grandmas dying of cancer anymore. That was the camel's nose under the tent, so to speak, in order to get the public to vote for medical marijuana. And then the same thing happened with legal marijuana, because there's a lot of people that I know that were in favor of it. Oh, tax the hell out of it. We're going to make a lot of money. That's been the narrative for decades. But it's kind of fallen flat.
Yep.
And all of my liberal friends in Colorado that voted for it have buyer's remorse. And that I honestly believe if they put that in front of the voters of Colorado today, I think it would fail, with legal marijuana.
Yeah,
Because of all the public health things that I have predicted for many years have started to come true. They're ending up on the news. And now my friends are like, "Well, I didn't know that." I go, "Dude, I was talking about this for years. Why didn't you? I'm not making this stuff up. Everything I talk about is based in science."
Okay, so let's go ahead and dive in. So, to a lot of our listeners right now, when you say the word marijuana, we've got, some probably as young as 20s and 30s, but most of them are just old heads like Mike. All right, and when they hear marijuana, they're thinking like, 1960s, or
You're
earlier.
older than me. I just need to go on the record.
That's
sir.
neither here nor there. So what they're hearing is, 1960s marijuana, hippie weed. What is the difference between the marijuana that a lot of our listeners may be, familiar with in one way or other, and what we're actually dealing with today in terms of, concentrates and the things that the kids are using right now?
It's horrifying. And I think the cart is so far in front of the horse when it comes to this industry that we're trying to play catch up. Especially when you're talking about potency issues. I mean, the weed of the 60s and 70s was 2 to 4% THC. The stuff they found in Peruvian mummies and in Chinese pharmacopoeia, they said, well, the Chinese have had it for thousands of years. That stuff really doesn't exist anymore. These products have been modified, genetically engineered to be super strong products. And for example, in Colorado, the average smoked flower concentration about 20%. So you're talking about 500 times, 400 times stronger than 1960s weed. And that's just the flower. I mean, they have products that are 30, 35% THC, which they never thought they'd be able to get flower that strong. And then that's only the beginning. Then you have these concentrates that are pushing, on average in Colorado, 40 to 50% THC. And then you get into the dabs, waxes, and shatters of the world they're available in medical and recreational dispensaries that are pushing 90%, 95%, some claiming 100% THC. These don't look like plants. They look like sticky earwax. I mean, that's why they call it wax. And the delivery system is a blowtorch. I mean, I don't remember the Chinese pharmacopoeia saying, well, the ancient Chinese were delivering their marijuana via a blowtorch on a heated dab rig.
So,
That
so,
just didn't happen.
so wait a minute, Doc. So you're telling me, right, that we've got dispensaries selling products 70 to 90% THC. In Ohio, we passed legislation. You can have 90% THC. That's the potency cap for concentrates, 35% for plants, and even that's high. But for concentrates, like you're talking about, we got 90% here. In the legislation that we have right now, that's running through the Senate, just passed the Senate, is being rammed through the House. They dropped it to 70%. And what we're hearing is, oh well, no, that's not going to be the end, the product for the end user. That's what we need to do to maintain, consistency and make sure that we get a good product. What say you to 70% THC that the Republicans are driving through the state house right now?
They don't know the science. Even in the European literature, European products they consider anything high potency greater than 10% THC.
10%.
That's what they're considering in Europe. And the European data shows that what they call high potency skunk, which is 10% THC product, an adult has a five-fold increased risk of psychosis. An adolescent using those products, more than 10%, mind you, have an 11-fold increase of psychosis. And you're talking about products, even though they're like, oh, we're 70% THC, that's still 600% plus stronger than the 1960s and 70s weed. These things are very, very strong and very, very dangerous.
I want to ask another question about the science, Dr. Finn. If this is being presented as a solution for pain management or an option for pain management, and you're saying in your research that you didn't find anything that backs that up, where's the disconnect between this could be a solution for pain management, but what you're finding as you look into this and see that the actual type of drug that marijuana is not necessarily going to impact that in a meaningful way?
Trust me, I can go on probably for a solid hour just talking about the relationship between the opioid and the endocannabinoid system. But I don't want to get too deep into the science. I think at the end of the day, from a basic science perspective, when you're looking at the molecules, there is evidence that cannabinoids may have pain relieving properties. But when you translate that into real world dispensary weed that people are getting, the data is clear. It does not help. I mean, I published, I think, 3 papers within the past couple of years clearly demonstrating that marijuana states have higher fentanyl death rates. So these drugs play very well in the sandbox together. And I'm not talking about just fentanyl death rates. I mean, in Colorado, over time, we've seen an increase in stimulant overdose deaths, including cocaine and methamphetamine. We've seen increased fentanyl death rates. States like Ohio, Oregon, Washington, Colorado, and all these marijuana states have higher drug overdoses than the ones that aren't going down this road. And I think all of the other data that is underneath that supports the very weak evidence that it helps with analgesia. There's a medication that's not available in the U.S. called Sativex that's available in Europe, and it's a natural cannabinoid that's not contaminated. It failed 2 phase 3 clinical trials for pain management in the cancer population. So it simply has not been proven to be very effective. I mean, not everybody that uses is going to become psychotic or have a problem, but you're dancing in the raindrops, in my opinion, when you're using these high potency products. It doesn't matter who you are, where you're from, what color you are, what race you are, what religious belief you are. It knows no boundaries. I've known people that are high level attorneys, doctors, and their child is negatively impacted. Educators, their spouse or loved one or family member is negatively impacted. It will touch every single person that's listening at one point in time.
The other thing that stands out to me as you were speaking there, Dr. Finn, is you list a whole slew of drugs that seem to be running parallel to marijuana, but we've been told time and time again that marijuana is not actually a gateway drug. Can you speak to that?
I firmly believe it is a gateway drug for multiple reasons. When you're talking about in utero exposure data, which that in and of itself is alone should have people pump the brakes on this. When you have these infants that had no choice but to be exposed to marijuana when they were being developed in utero, those kids are having problems long term. And actually, those kids actually have a higher propensity for developing opioid use disorder, even if they're not using. So it primes the pump, so to speak, for using other drugs. I firmly believe marijuana, just like alcohol, is a gateway drug. And we haven't done a good job with the legal drugs we already have. That's the one thing I clearly point out to legislators that I work with. Why are you going down this road when we know alcohol and tobacco kill hundreds of thousands of people a year? Opioids is a scourge, and now you're going to add another layer of addiction for profit, quote, medicine or legal recreational. What are you even thinking? We had those boats have already sailed the dock, and
Right.
now you have one sitting in the dock, and you're going to be like, okay, what could go wrong? It's herbal, it's natural, it's medicinal, whatever. We've done a terrible job with the legal drugs we already have, and now we're going to add another layer of social impact.
And Doc, I want to be very specific here because we've got legislation, like I said, it's running through the House and the Senate. Um, it's a decent bill on this side of legalization, right? So we've got some constraints around, advertising. We've got some, we can allow employers to have zero tolerance policies. You can't smoke it on the street in public. It's got some good things in it. All we're asking is we got to drop that potency. 70% is just as ridiculous as 90%. At least get it down to the level of the plant at 35%, if not 15, which is, which is nationally recognized as even, high potency still. But I mean, that would even help. And then we're asking for regulation, or not regulation, we're asking for reporting and research appropriations to be made so that we can know the harm that's happening. Case in point, is marijuana a gateway drug? Absolutely it is. But who cares? This is 2025. We know that in Colorado, marijuana or THC is the number one reported substance found in completed teen suicides, at least twice as much as alcohol. That is decades beyond gateway drug. This thing is killing kids with psychosis, and can you just talk to that just briefly? Like, what is psychosis, and how is this impacting kids in Colorado and across the country?
Well, there's a lot to unpack there, David. So, some of the things that you mentioned, I think, are positive. Um, However, some of those things are somewhat laughable. No public use. Okay, well, we have the same thing in Colorado, and people use them. If anybody's been to downtown Denver at the 16th Street Mall, it reeks of weed.
Yep.
If anybody's been to New York City in Times Square, it reeks of weed. And I'm from New York City. And New York City today reminds me of what New York City was when Mayor Koch was running in the 70s. It was a dump. And it was a drug haven. So yeah, no public use. Good luck with that. That's not going to happen. But to try to rein in the potency, I think is very important. I think that's really good that you're trying to tackle that. And I would agree, Vermont probably has the lowest restriction at 30%. So I give them kudos. But I would prefer, from my perspective, the 10% or less. I don't think that'll ever happen because they're going to say, well, it's going to blossom the black market. Well, the black market's alive and well in Colorado, despite all the rules and regs that we already have. But when you get to psychosis, by definition, that's basically a break from reality. You see things that aren't there, you hear things that aren't there, you behave in manners that are atypical for yourself. For example, Bren Spetcher, if anybody's not familiar with her case in California, she was a very bright young woman who she was with her friend who was a frequent marijuana user, but she was not. She was somewhat marijuana naive. Have you guys heard of her? Bren
No,
Spetcher?
no.
No.
Google this one, man. It'll very interesting. And I would encourage any of your listeners to look this up. So Bren went with her friend to his apartment, and he did a behavior. I never heard of this. I mean, I haven't done this for so long. I learn stuff every day. There's a behavior called stacking. And what they do is they'll light a bowl and a bong and they'll inhale it, but they won't inhale the smoke. But they'll reload another bowl, and get the smoke in the bong, but not inhale it. And they would stack bowl after bowl after bowl, but they have this very milky smoke that's in the bong. She took one hit off of that bong, became acutely psychotic, stabbed and killed her friend 108 times with two knives. I mean, the law enforcement had to break her wrist with a baton to let go of the knife. She tried to slit her throat. She tried to kill the dog. She had acute cannabis-induced psychosis. And I want to be very clear, not everybody that uses it is going to become acutely psychotic. But again, there's no good predictor, so you do not know who will it be. She served no time. She was on Dr. Phil. There was two 1 hour episodes on cannabis psychosis. I would encourage everybody to watch it. And she describes her experience of cannabis psychosis. And I can tell you, I have a growing compilation on my computer of autopsy reports and toxicology reports of things like beheadings, mutilation, homicides, mass shootings that are only circulated around THC, the only thing in their toxicology report. So again, it's to be clear, not everyone that uses is going to become psychotic, homicidal maniac, or mass shooter, but you got to be careful. These I don't hear about these things as much with alcohol-induced psychosis or even cocaine-induced psychosis or methamphetamine-induced psychosis, because all of these drugs, like I said, play well in the sandbox, and all of them can precipitate psychosis. And one of my colleagues and friends who's a 45-year practicing retired psychiatrist told me, and I was very surprised to hear this, of all the substance-induced psychoses, cannabis psychoses is the one that scared her the most because they were the most violent people that had substance-induced psychosis. I was very shocked to hear that because, marijuana's supposed to chill you out, make you mellow. And most of the people, that's kind of been their experience. But you'll never know who it will be that will suddenly become psychotic. And I've met more parents that have lost children to things like this. I mean, Christine Kirk was shot in the head in Denver after her husband gobbled up a bunch of edibles shortly after we legalized. And I have his toxicology report. He became acutely psychotic. She called 911. As they were on their way, he went to the gun safe, popped her in the head in front of their kids. She's dead. He's serving 30 years in prison, and now their three children don't have any parents. These things and these episodes will tear families apart. Trust me, I've met too many parents and family members that have been ruined over this
For
plant.
all you members that I'm driving you nuts and have been driving you nuts about marijuana for the last several years, this is why. It is very difficult for me to explain all that he's explaining and unpacking in this podcast in the 20 minutes I might have in your office. But we have got to do something, at least take the microphone away from the industry, right? The addiction for profit industry that got us into this mess. They cannot be the ones directing policy and safety of our kids as it relates to marijuana. As we get ready to close here, we are dealing with intoxicating hemp. And putting some regulations around there. What are some forms of intoxicating hemp, and why is it a problem?
David, there's a lot there, and thank you for bringing it up. And I think I'm going to rewind 1 sec. I think you hit the nail on the head. Science should guide by policy, not public opinion. Again, science should guide policy, not public opinion. When you're talking about the intoxicating hemp products, this is the back door or side door. The industry knew exactly what to do when they passed the Farm Bill. They knew exactly what to do. I'm going to get a little bit scientific here. So you have delta 9 THC, which is a molecule. And when they passed the Farm Bill, the quote legal hemp products are required to have less than 0.3% THC. And what they do with the hemp is they mass produce CBD, right? And from that CBD, which is a different molecule, it actually has the same molecular formula as delta 9 THC. And what they do with this CBD that comes from hemp is they can manipulate the molecule and create other molecules that have the same molecular formula, like delta 8 THC, delta 9 THC, delta 10 THC. And then they can further manipulate those molecules into other intoxicating products like THCO. I don't know if you've heard of THCO or not, or THCP. And all of these analogs and isomers of the hemp products, they're all THC. But that's kind of the side door because it comes from, quote, federally legal hemp, right? And so these other products they're basically THC. So the Delta 8 may be not as strong as Delta 9. THCO, and I'm more than happy to provide the information, was actually weaponized by the US government in the 1940s as a chemical warfare agent. And yeah, he's shaking his head. He's like, "What?" I'll send you the link to it. I have the science behind it. It eroded dogs' muscle coordination 3 times more than conventional THC, delta 9 THC. Um, and as an analogy, heroin is the O-acetate of morphine, and we know how dangerous heroin is. THCO is the O-acetate of the delta 9 THC, or actually the delta 8 THC product. So when you acetylate a molecule, it penetrates the blood-brain barrier quicker, is stronger, more intense. THCP and these other analogs, for example, are over 30 times stronger than traditional delta 9 THC. And on a personal note, I have a friend from the Dallas area. You can buy these hemp products at a gas station, a grocery store, convenience
Right.
store, whatever. No age restriction. And the 17-year-old kid was sold a federally legal hemp product that had delta 9 and THCP in it. And there was 200 milligrams total in each gummy, and there were 5 of them. He ate all of them at the same time. So he took 1,000 milligrams of, we're still trying to figure it out because according to Texas law, every hemp product needs a QR code or a URL to find out the content. There's nothing on the package showing the content. And if that was truly a legal hemp product, it would only allow 15 milligrams of delta 9 THC. Therefore, each one had 185 milligrams of THCP, which is 33 times stronger than delta 9 THC. And this kid was obtunded. His parents couldn't wake him up. He went to the hospital. He did not get snap out of it for 4 days. He was completely out of it. And that, my friend, is a dangerous product. And that is what the industry wants, the money. This is just, luckily the kid doesn't, I think he does have a cannabis use disorder, but that my friends are kind of going down that road now. But that's the products that we're contending with. And literally in Texas, a 10-year-old could buy that product. There's no age restrictions, zero.
Wow. That is shocking stuff, and shows the really dark side of this being legalized is that people just assume, well, it's legal, it must be okay. But they're unaware of how toxic these products really can be, or at least the potency behind them. That's
Yeah. And it's
astounding.
important to note that this was not a constitutional amendment, right? The state legislature can put regulations and guardrails around what the people voted, for last November. And so that's important for us to understand, is that there's nothing wrong with us putting some safeguards around this very, very
No,
dangerous drug.
not at all. I mean, people say I'm a prohibitionist, and I'm not. I mean, it's here. I can't put the genie back in the bottle. I can't blink my eyes like Major What's His Face did with I Dream of Genie. But it's here to stay. So now you just need to put the guardrails and the caps on to keep your community safe. You should have age restrictions. You should have potency caps and limitations. I do a lot of work with other state legislators around the country. One from South Dakota thanked me for the front row seat to the horror show, which I took as a compliment, because they just don't know the road they're going down. The things what we had in states like California, Oregon, Washington, Colorado, we had what we describe as unintended consequences. And now state legislators cannot claim ignorance.
That's right.
I strongly believe that if they go down this road and you do track and monitor the public health implications, that will be their legacy. And I think down the road, you need to continue to call them out. Say, you voted for this. You voted for these mass shootings. And there's some from Ohio, by the way. You voted for these kids that have marijuana in their system when they complete suicide. And like David mentioned, marijuana, and I looked at this data yesterday, it is still the most prevalent substance when a teenager kills themselves. And it's actually the most prevalent substance when anybody under the age of 25 in the state of Colorado kills themselves, or if it's a non-homicidal death, marijuana is still the most prevalent substance when anybody under the age of 25 is dead and they have no reason. Marijuana or marijuana plus other substances, the presence of marijuana is still the leader.
Yeah, everybody listening to this podcast needs to send this to your senator and your state rep, anybody in the governor's office, because enough is enough. When I tell you The only thing they know is that, okay, it might be a gateway drug. And two, hey, this is all I can do. We got to ram this through. I'm tired of hearing that. This is no joke. And hopefully you've learned that from Dr. Finn on this podcast.
Yeah, and Dr. Finn, since you mentioned people not being able to claim ignorance because of the 2 decades of hard data that we have now from states that have legalized it, I'm curious, you were an early voice against this when there weren't a lot of people speaking out. How is having the data behind you now helping you get this message out? Do you feel like the legislators, the states that you're speaking to, are more responsive than they have been in the past?
Oh, absolutely. I mean, honestly, I was like, what am I missing? I felt like Horton Hears a Who. I'm like screaming from the top of the snowflake. Nobody can hear me. But it's pushing a boulder up a hill, honestly. But over time, we have found like-minded doctors and scientists and researchers that are really kind of sounding the alarm about the public health. I mean, this is again, they say, well, compared to alcohol, they kills thousands, hundreds of thousands of people a year. Yes, it does. So did we do a good job with it? No, we did not. And now we just simply have another substance. And I believe me, cannabis, as much as people perceive it as herbal, natural, safe, medicinal, or what have you, the impacts are, I think, more broad, wide, and deep than any other substance, including tobacco and including alcohol. And my prediction, although I may be wrong, and I hope I'm wrong, but so far I haven't been wrong. I think the public health implications of cannabis, especially when you're looking at in utero data, driving fatalities, healthcare utilization, pediatric exposure, suicide, addiction, all this other business, is going to be worse than any other substance within the next 15, 20 years when all the data is finally unrolled. People will be like, oh my God, what were we thinking? We did a terrible job with this. And so far, I've been saying that for years, and I've been right. I don't, I mean, we like to be right, but I would prefer to be wrong. Because if I was wrong, I'd crawl into a rock. Nobody would remember who the hell I was. But so far, I haven't been wrong. And that kind of scares me. Because if these things are going to continue to happen and the harm is going to persist, I think in 15, 20 years, maybe even 30 years from now, hopefully sooner, the light bulb will go on. I don't know if it's going to be society's tolerance to body count that finally turns the switch, but I think it's going to be very important that you monitor. I think Colorado's done a very good job tracking data. The problem is mainstream media doesn't latch onto it because it doesn't make good news. That's the other problem. You need to have a very independent media campaign that's not mainstream media because they don't talk about this stuff. You can't get through to anybody like on Dateline or 2020 or CNN saying, listen to us. We're sounding the alarm and nobody's paying attention. That's why I continue to do what I do. My wife's like, why do you keep talking about this? I said, because it's the right thing to do.
Well, we for one in Ohio, and I for one am very thankful for the help that you've been providing us. And some folks are waking up again. We do need a new brain trust here across the street at the State House for sure, because somebody other than some dope dealers. But I mean, it reeks of marijuana in the hearing rooms for the last 4 weeks. But thank you, Dr. Finn, for all of the wisdom that you share with us, and I do believe it's making a difference.
Yeah, and real quick before we let you go, is there anything that our listeners can and should be doing? I know David made a great call out. Send this podcast to their state reps, their state senators. From your work, Dr. Finn, is there anything that our people could get their hands on that would also help them talk about this issue or roll this issue up to their legislators?
Yeah, one thing that we didn't have time to talk about is product integrity. There was a recall. Colorado's had 4 recalls since the beginning of the year for product that was contaminated with pesticides, fungus, mold. And it's almost laughable because they're like, well, return your product that was sold sometime in 2024. Those products are gone. I mean, that's one of my platforms is I tell my patients, I tell my friends that are users, I said, buyer beware. You do not know that what you're taking is actually what's on the label or what's in the bottle or what have you. I would refer people to the state of Oregon's marijuana audit report from 2019, where the state of Oregon, that's had very robust medical and recreational programs for years, concluded that the testing results are unreliable and the products may not even be safe for human consumption. But onward they go. That made no blip on mainstream media about the safety concerns of product, even in the regulated industry. And in Northern California, those black market products are ending up in legal stores. They're not tested for pesticides or fungicides or anticoagulant rodenticides. Product integrity is huge. And everybody says, well, we're going to do it right, blah, blah, blah. Good luck. I think people are trying to do it right, but not everybody's doing it right, and nobody's being held accountable for the harms associated with these contaminated products. And I can go on for another 30, 40 minutes just on product integrity.
Well, we'll have to get you back to have that conversation. Dr. Finn, keep on shouting from the mountaintops. We need your voice out there. We're grateful for the time you gave us today on The Narrative. Thanks so much for joining us. Thank you for tuning in to this episode of The Narrative, presented by CCV and produced by Wessler Media. If you found today's episode insightful, leave us a review or rating and subscribe anywhere you get your podcasts. We're your hosts, Mike Andrews, Aaron Baer, and David Mahan, and we'll see you next time on The Narrative.